everybody, welcome to episode 14 of Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Gabapentin. The brand name for this medication is Neurontin. This medication is classified as an anti-epileptic, so it's used mainly in people that have seizures. However, we do see it used for some other conditions as well, which we'll discuss in a moment. Now, Gabapentin is available as capsules, tablets, as well as a solution. It's most commonly given in the capsule form. The capsules are available in a 100, a 300, a 400, as well as an 800 milligram capsule. And the tablets are available as 600 milligram as well as 800 milligram. The concentration of the oral solution is 250 milligrams per 5 milliliters, or simply 50 milligrams per mil. So as I mentioned, it can be used for other conditions besides just epilepsy. Some of these conditions are as follows: post-herpetic neuralgia or neuropathic pain. There's some preliminary data to show that it can be used in panic disorder, but only when this disorder is severe. It can be used in social phobia or generalized anxiety, and sometimes as an adjunctive agent in PTSD or post-traumatic stress disorder. It can be used alongside of an SSRI or selective serotonin reuptake inhibitor when treating obsessive compulsive disorder. And lastly, it can be used as an adjunctive agent in opioid withdrawal. Aside from age factors and kidney function, there's not really many contraindications to this medication, so we're not going to discuss contraindications in this episode. However, we will talk about some precautions to use before the medication is administered. Now, gabapentin is not considered to be very effective in treatment of absence seizures. Therefore, it should be used with caution in individuals who are using it to treat mixed seizure disorder. Upon initiation of the medication, it's important to be monitored for signs of worsening mood, which could be the emergence of worsening signs of depression, as well as suicidal ideation or suicidal thoughts. It's important to have your kidney function monitored while you're on this medication because the dose has to be adjusted as kidney function declines. As with most anticonvulsive agents or anti-epileptic agents, it's important not to discontinue the therapy abruptly. If it's decided between you and your physician that you're going to be stopping the medication, they'll give you a schedule how to taper the medication to decrease the medication slowly. This way, you'll decrease the risk of having adverse effects. People that have stopped the medication abruptly have experienced the following symptoms: anxiety, insomnia, nausea or pain, as well as sweating. The minimum period that this medication should be tapered in is a 7-day period or a 1-week period. It's a good idea, however, to extend this longer than 7 days. Again, your personal healthcare provider will help you with this taper schedule. When starting this medication, the starting dose can be anywhere from 100 to 300 milligrams taken 3 times a day. An individual's clinician will decide what dose they'll start on. Then, it's usually increased by about 300 milligrams every day until the target dose is reached. In practice, I see doses of about 3,600 milligrams per day or 4,800 milligrams per day. The maximum daily dose would be 6,400 milligrams. This dose comes from RX files. The dose will change from person to person, as well as depending on what indication they're using the medication to treat. Plus, the personal clinical experience of the physician comes into play. While you're taking the medication, you don't have to worry about taking it with a meal, as it can be taken without respect to food. That is, you can take it with or without food. There are several side effects you could experience while using this medication, so I'll list some of the more common side effects for you now. Somnolence or tiredness seems to happen in about 20% of individuals. Dizziness comes in at 17%. Ataxia, or loss of control of several body movements, comes in at about 12.5%. Nystagmus, or rapid eye movements, comes in at 8%. Tremors seem to happen in about 7% of people. Fatigue comes in at about 11%, and weight increases coming in about 3%, and usually would be dose dependent. Double vision can happen in 6% of individuals. And lastly, peripheral edema or swelling on peripheral parts of your body, such as your ankles or wrists, happens in about 2%. Aside from those main side effects, if you were to take too much gabapentin or just experience toxicity, signs that you may experience would be double vision, slurred speech, drowsiness, weakness, and diarrhea. If you experience several of these symptoms together, it'd be a good idea to get checked out in the emergency room. I've mentioned in other episodes whether or not medications could be treated with antidotes. This medication can be removed from your system using hemodialysis if the attending physician thought it was necessary. That's all I'm going to talk about today with gabapentin. As always, this channel is for information purposes only. If you think I'm providing valuable information, as always, you can help grow the channel by liking the videos, sharing the videos, or subscribing to the YouTube channel. That's it for today. Take care.